Welcome to another episode of Autoimmune Alchemy, where we're blending science with soul. My name is Dr. Micah Yu, your host, and today we have a very special guest, Dr. Alfred Miller. He is a rheumatologist who trained at Mayo Clinic and worked for 40 years as a rheumatologist and an internal medicine doctor in Texas and taught at the University of Texas San Antonio Branch Medical School. He's a very special guest because he is one of the very few rheumatologists in this nation that talks about Lyme disease, rheumatoid arthritis, and autoimmune disease in a very different way. He's now retired. He's been retired since 2008, but he has a lot of information that we can learn from. So thank you so much, Dr. Miller, for coming on this podcast today.
My pleasure. Thank you. Thank you.
Yeah, thank you so much for giving us this insight today. I think it's very important for everyone all over the world to learn about this, not only with the rheumatic disease, but different chronic illnesses as well, because Lyme disease can be a common factor in different tick-borne infections. So tell us, how did you even get to this point of learning about Lyme and believing that it can even cause problems in patients?
Thank you for asking. Um, as a rheumatologist and practicing rheumatology and internal medicine, if I had a patient, and I did that for 40 years, if I had a patient with a neurological problem, I referred them to the neurologist because it wasn't my area of expertise. And that was my pattern for the full 40 years. I retired in 2008, and my son and daughter-in-law living in Boston contacted me because my daughter-in-law developed some neurological problems. Her primary care physician referred her to Harvard neurologist, Dr. Merit Kutkowitz. Dr. Kutkowitz evaluated my daughter-in-law and contacted me and said, Dr. Miller, this is unusual, but your daughter-in-law, the MRI of her brain is multiple sclerosis. However, her physical examination, motor neuron disease, is Lou Gehrig's disease, ALS. She said, it's a little unusual, so I'm going to send her to Beth Israel for a second opinion. She did, and she saw another Harvard neurologist at Beth Israel, and they came to the same conclusion. So because I trained at the Rochester Mayo Clinic, I really wanted her seen there for another opinion, and she saw Dr. Sorensen in the Department of Neurology, and he evaluated her very thoroughly and contacted me and said, Dr. Miller, your daughter-in-law has the MRI of multiple sclerosis in her brain, but physically she has ALS, Lou Gehrig's disease. So he says, I'm going to diagnose her as Lou Gehrig's disease. And because she's developing bulbar involvement, her prognosis is very poor, maybe 4 months or so to live. So I've instructed her to go home and write essays to her 4 children so that when they become adults, they can read the essays because she will not be available. So it was disappointing to hear 4 months. So I went to the medical literature to determine what could cause that picture. MRI of multiple sclerosis in the brain and physical examination of ALS. And it was neuroborreliosis. And if you'll notice during this presentation, I'm not going to refer to Lyme disease. I'm going to refer to Borrelia infection. And that's specifically because there are approximately 40 species of Borrelia. They all have the same impact on the patient in terms of how they affect the patient's body. They all respond to the same basic medications. But if you designate this as Lyme disease, depending upon where the patient is located, for instance, in the Northeast, the most predominant Borrelia infection is Borrelia burgdorferi, and that's known as Lyme disease. And here in Texas, we don't have that. So if a patient went to the doctor and said, I want to be tested for Lyme disease, the test would come back negative, and there would be an erroneous conclusion that the patient did not have a Borrelia infection. Because in Texas, we have relapsing fever Borrelia. The impact on the patient can be identical. And in the January 2013 issue of the New England Journal, your listeners or people watching this program can look at that article. January 2013, New England Journal, about an 80-year-old woman living in the New England area. Her family brought her to the doctor. She had about a 4-month history of dementia. They were very concerned. And the doctor said, well, she's 80 years old. She probably has Alzheimer's. He said, but in her history, she had lymphoma. He said, let's do a lumbar puncture and see if maybe the lymphoma went to her brain. So they did. And in the article, if you look up the article, you'll see pictures of slides made of the spinal fluid. And in the spinal fluid were Borrelia spirochetes. And they treated her with antibiotics. And after about 4 months of treatment, she improved dramatically. So it's very, very important to consider the Borrelia infection.
And also with the Borrelia infections, not a lot of doctors are looking for it. And there's so many ways for testing this. How do we get the right test out there? There's so many options.
Yes, I'm so glad you asked. There are at least 40 different species of Borrelia. So therefore, the laboratory has to be a tick-borne disease laboratory. Now, in my daughter-in-law's case, all 3 of these academic institutions, I contacted them and I said, did you test my daughter-in-law for Borrelia? Oh, yes, we did. And what were the results? They were all negative. I said, well, send me the results. Send me the copies of the test and the results. Well, they use the definitive test is called the Western blot. And it's the different antigens on a piece of paper and then track the antibodies in the patient's blood. And if they match up, of course, it shows up as a connection. And bands 31 and 34 on the Western blot are specific for Borrelia burgdorferi. So I looked at the Western blots that were done at these academic institutions, and 31 and 34, these were Western blots that were condoned at that time in 2008 and even today. This is a Western blot condoned by the CDC, and they omit 31 and 34. So if a patient had an infection with Borrelia burgdorferi, it would show negative because they're not being tested. And I was trying to figure out why aren't they being tested? Well, in the year 2098, there was a vaccine on the market. I'm sorry, 1998. In 1998, there was a vaccine on the market called Limerex. And Limerex consisted of 2 proteins to prevent the Borrelia burgdorferi. Those were the proteins found in bands 31 and 34. So the CDC at that time said, as long as these patients are going to get vaccinated, the test is going to be positive. It's going to be a false positive. It's going to be due to the vaccination, not to an illness. Well, this Limerex was on the market for 2 years. They took it off the market in the year 2000. So from 1998 to 2000, some of the patients, very few, received Limerex. It was taken off the market because of side effects, but it hasn't been on the market for 25 years. And still to this day, the Western blots omit 31 and 34. So I sent her blood to a lab that included 31 and 34. It was very, very positive. And with that, I treated her with antibiotics. And they gave her 4 months to live originally. She lived for 7 years and died of a totally different illness. So I was very encouraged. And because of that exposure, I became very, very interested in this subject. And since 2008 until today, I spend, I bet, 8 hours a day on this topic. And it's so fascinating because it affects virtually every field of medicine. And the proper testing is very, very, very important. Number one, the laboratory has to be a tick-borne disease laboratory that includes all the different species. In addition, all of the tests for the Borrelia measure antibodies to the Borrelia. When the Borrelia enters the patient's body, after a very short time, it becomes a microscopic cyst, buries itself deep, deep, deep into the tissue, and does not challenge the patient's immune system. Therefore, there are no antibodies produced. And the test comes back negative. And I was on the radio in Boston, been on the radio, I think, 7 hours in Boston at different intervals. And they made blogs of the program, and they've gone all over the world. And I received an email from a patient in London. And the patient said, I've been diagnosed with ALS. I did the exact test that you recommended. Here are the results. Please interpret. So I looked at the results, and they were done at a lab in Europe called Armin, A-R-M-I-N. Armin lab in Europe is very good. It's in Germany. And the results were completely negative. So I told him, let's expose your Borrelia to your immune system and then repeat the test. So I gave him a medicine that opens up the cyst, because the cyst is completely impenetrable to an antibiotic. So we use Flagyl or a derivative of Flagyl called Tindamax to open up the cyst. And then we use a different antibiotic to bring out the spirochete. It can be Ceftin or Viaxin or erythromycin, tetracycline, a variety of different antibiotics. And that brings out the spirochete and challenges the immune system. I said, I want you to do that for 28 days. The reason it's 28 days, I'll explain that in a few minutes. He did that, and after the end of 28 days, he repeated the exact same test in the exact same laboratory, and this time they were very, very positive because he had the antibodies. The reason I said 28 days, bacteria consume antibiotics during their reproductive cycle. So as a comparison, Streptococcus reproduces every 20 minutes. So if a patient has a sore throat and it turns out to be strep, then the doctor treats with penicillin or penicillin derivative for 10 days. At the end of the 10 days, it's 720 reproductive cycles of the organism, and the patient is cured. In Borrelia, they reproduce every 28 days. 28 days. So this Streptococcus is every 20 minutes, really every 28 days. So it's important that you bracket those 28 days with your treatment. Even today, if a patient presents themselves at the emergency room, let's say at Harvard or any of the institutions that are supposed to be savvy, with a recent tick bite, the emergency physician will say, okay, no problem. They put them on 2 weeks of doxycycline. Well, that'll kill all the Borrelia that are reproducing during that 14-day period. But those that are not being treated during the balance of the 14 days, they sit there. They can either become dormant and later start developing, reproducing and creating the illnesses.
Wow.
So every patient, I recommend provocative antibiotics to make sure that the test is valid.
And with the provocative antibiotics, do you do it for the full 28 days?
Yes. And then do the test. Based on the results, then we engage in a treatment.
And do you use Flagyl and Tindamax, or do you use other antibiotics?
I use either the Flagyl or the Tindamax because those are cyst busters. You don't use a cyst buster, the other antibiotics will not penetrate. So we use one of those to open up the cyst, and then a different antibiotic to bring out the spirochete. And by the way, many patients at these academic institutions who have illnesses that we attribute now to Borrelia, they say, okay, if you think that this illness is secondary to an infection, they give the patient 30 days of intravenous antibiotics, let's say Herceptin. At the end of the 30 days, their patients are no better. They said, well, we told you that. Yes, but they didn't add a cyst buster. So the antibiotics, they could give the Herceptin intravenously for the next 12 years. The cyst is impenetrable by the antibiotic. So if they add Ceftin, if they add Tindamax or Flagyl, then the whole results are different.
And with the Tindamax and Flagyl, what dosing are you giving? Are you pulsing it, or are you giving it every day?
Well, it's interesting that you asked that because because the reproductive cycle of the Borrelia is every 28 days, the treatment has to be prolonged. So protocol that I use for using antibiotics, we can't use antibiotics daily for an extended period of time without having various complications. So I recommend strongly the pulse method. And we use the pulse method. We use a heavy dose of antibiotics and the cyst buster, 3 days on, 4 days off, 3 days on, 4 days off. And we do that for several months to incorporate the reproductive cycle of all the Borrelia.
And how long are you doing this pulsing for? Is it for 3 months, 6 months?
I tell the patients in advance it's going to be for a minimum of 12 months. And because these organisms can be dormant and bury themselves, once the patient is showing no signs of the infection, you cannot rest because you've killed the Borrelia that are vulnerable. Those that are hidden deep into the tissue, you don't touch. I mean, they just sit there, and they may come out at a later time. So once the patient has an infection with Borrelia, I recommend doing testing about every 6 months. And the test that I recommend is called the CD57. CD57 in the laboratory are like his LabCorp. I have no connection with LabCorp, but they do the proper CD57. CD57 is an inflammatory cell, and all the inflammatory cells in the body are given labels. And the CD56 cell evolves and becomes a CD57 cell, unless Borrelia infection is very active. And then it halts the evolution. So if CD56 doesn't become CD57, then the CD57 population drops. And if the patient's CD57 is very low, you know that the infection is active. For instance, in my daughter-in-law's case, she had the ALS. Her initial CD57 was 38. The normal is from 60 to 360. So at 38, we knew that the infection was very active.
And with the CD57, if it's low, is it specific for Lyme? Can anything else cause a low CD?
No, nothing else has been identified to cause it.
And when we see a low CD57, can we say that's diagnostic, or do we have to get other tests to support CD57?
Depends on what the doctor or the patient feels comfortable with. I always like to get a definitive test to prove exactly what they have, because in addition, these laboratories that do tick-borne diseases, in addition to the Borrelia, they look for all the co-infections as well. And some of those be pretty significant, like Bartonella especially, Babesia. And a good laboratory will include those. And if those co-infections are present, then you need to address those as well.
And with those co-infections, such as tick-borne relapsing fever, Babesia, Bartonella, can those drive down CD57 as well? Or is it only specific for Lyme?
It's only specific for Borrelia. If you notice, I don't use the word Lyme because people just get focused on, I was at the meeting where Dr. Alan Steer, who was in his training program at Yale in 1997, I was at a meeting at the American College of Rheumatology. We had our annual meeting, and he was invited to address us. And he stood up at the front of the room and he said, "Physicians, rheumatologists, I want to tell you about a new form of arthritis called Lyme disease." And we all looked at each other like, "What are you talking about? Lyme disease?" He said, "No, it's not Lyme, it's Lyme, because there were a group of young children who were developing severe rheumatological problems, and he determined that it was due to an infection. So it became known as Lyme disease because it was in Lyme, Connecticut, where it was first noted." Well, that was in 1997, and not much progressed after that. And it wasn't in my differential diagnosis until after my experience with my daughter-in-law.
Yeah, let's dive into your experience with the daughter-in-law a bit more. So just to clarify, she was diagnosed initially with ALS from an academic institution, but you end finding...
She was not. They said it was negative.
Oh, it was negative.
They said all of the testing they did was negative. The testing I did was positive.
Mm-hmm. And so you discovered that she had Lyme disease. Is that correct?
I discovered that she had a Borrelia infection, and that's where I focused.
Yeah, Borrelia infection. And she was treated with, is it doxycycline? Which antibiotics did you give her at that time?
Okay, I used the pulse method, 3 days on, 4 days off. And when there's severe neurological infection, it's preferable to use intravenous. So I started her on Rocephin, but a heavy dose, 2 grams BID for 3 days, along with a cyst buster, specifically either Flagyl or Tendemax.
Hmm. And then with the Rocephin, which form does that attack? Because it doesn't attack the cyst form, correct?
No, you have to use either Flagyl or Tendemax to open up the cyst. And it's interesting. I came across the article, I think it was dated 1990. I'm not sure if it was from Poland or some, where they put the cystic form in a culture. And when they added Flagyl, the cyst opened.
Mm.
And that's how it came across that. And
And,
by the
and
way, let me just say this to many of the viewers and listeners to this program. Many of the things I'm telling you sound so unbelievable. I would encourage, if anyone is doubting what I'm saying, I want to encourage them to go to a website called PubMed, PUBMED. PubMed is a website that contains every medical article in the world that's peer-reviewed and published in medical journals. And they can go to PubMed and confirm everything I'm telling them if there's any suspicion in their mind that this could not be true, because it's so eye-opening.
yeah, we as rheumatologists don't learn too much about Lyme disease, even though we do see it from time to time. And the public, unfortunately, because of testing and the education on the doctor's part, don't encounter this much either. And sometimes they can get misdiagnosed or undiagnosed, just like in your example, your daughter-in-law's case was undiagnosed with
Yeah.
Borrelia infection. Um, so does the Rocephin attack the spirochete form then?
Yes.
Okay. So we have to attack both the cyst form and the spirochete form at the same time, or can we attack them at different intervals?
The cyst, the microscopic cyst in which the Borrelia is hiding, is impenetrable to an antibiotic unless you open the cyst. If you open a cyst, whether it's the motile form of Borrelia or the cystic form, once you open the cyst, the same medicine will attack both.
Got it. Okay. And as far as testing is concerned, you mentioned band 3134. They had a vaccine for it, and some of these labs didn't include band 3134 anymore because even though the vaccine never came into use in medicine, they still didn't bring those two bands. So which labs should patients be really looking forward to, and which one should physicians be using to test Borrelia
Yeah.
properly?
Thank you, Francie. And I have no connection with any laboratory. But if the patient is in the United States, I strongly recommend IGeneX, IGENEX. You go to their website, the physician can request a collecting kit. They mail that to the physician. It consists of a kit with some small tubes, a mailer, overnight mailer. And the physician fills up those tubes and sends them back to IGeneX, and that's how the test is done. If the patient is living in Europe, I recommend Armin, ARMIN. It's a very, very good lab, and they'll do similar.
That's great. And then as far as IGeneX concerned, because I use IGeneX as well, and with IGeneX, you can get the antibody testing, you can get the fish testing as well, which is a bit more expensive. Do we have to get the fish testing, or can we just get the antibody testing and that'll be good enough?
I want them to test for the Borrelia and the associated co-infections. So there's a panel, it's called TBD, tick-borne disease panel. I think it's panel number four. And they have on their website, they have a list of the different panels that they offer. So you want one that includes Borrelia and co-infections.
Mm-hmm. And is the IgM, IgG testing good enough on these panels, or do I have to get, because they also have options for the plasmid, whole blood plasmid. They also have options for the fish testing as well. Do we need those?
No. If the patient has a positive test for Borrelia, you need to assume that that's the culprit and or the co-infections.
And as far as let's do a deeper dive into the antibody testing, because there's IgG and IgM. results here. And traditionally in medicine, we learned that IgM positivity means a recent infection or active infection. IgG means a past infection. Is that the case for Borrelia and these co-infections, or is it more nuanced and more difficult to diagnose based on these positive results?
No, I think you're absolutely right. And the testing that they do includes IgM and IgG. And if it shows both are positive, that means that the infection has been recent. If it's IgG, it's an older infection. But who cares? As long as we know that the patient has it really inside of them, it can remain dormant for years. As an example, chickenpox, a patient gets chickenpox when they're 6 years old, and at age 60, shingles. That organism, that herpes virus has been dormant for all those years, and then it comes out as shingles. And it comes out, I think, primarily because the immune system, which has been holding it in check, becomes diminished. And by the way, Borrelia can also do that. Borrelia can weaken the patient's immune system.
Mhm. Right. I have patients who tell me that they got bit when they're 6 years old, or they were allowed ticks, but they didn't get problems till 40 or 50 with rheumatoid arthritis, lupus, or some other autoimmune problem that they're seeing me for. And I'm assuming that is a case where what you just mentioned, that it's some of these infections can lie dormant and they take opportunistic time to come out and attack these patients. And sometimes does it manifest with different autoimmune diseases then?
Yes, and I'm glad you mentioned that because for 40 years in my training and during my 40 years of practice, I treated and you're treating so-called autoimmune diseases. And I have come to the conclusion now that autoimmune diseases is illogical. It's illogical. The immune system is supposed to protect you from invasion by infected organism. And for it to attack you, it's illogical. And I think that it's flawed. And because of that, I have looked at every single illness, basically, that's attributed to autoimmune. And when these patients who are diagnosed with autoimmune diseases are properly tested with provocative antibiotics, they are all, when I say all, I mean 100% positive for a Borrelia infection. And it touches every specialty in medicine, everything from neurology to psychiatry, podiatry, you name it, gastroenterology, every specialty. The illnesses that have labels, the labels reflect the symptoms. But when you dig deeper, the underlying infection is Borrelia. And many of these illnesses, the pharmaceutical industry has perfected many, many drugs to treat the symptoms of these illnesses, everything from Parkinson's to, you name it, ALS, multiple sclerosis. And they are treating, the analogy I like, they're treating the smoke, and they're not extinguishing the fire. And by the way, let me mention this. I think you'll find this interesting. In 1981, a group of United States rheumatologists were invited to come to China to visit rheumatologists in China. And we met with the professors and the teachers of rheumatology, and they took us to the big hospitals in China. They're very impressive. And they told us about how they were treating these patients who were more ill and they couldn't stay out of the hospital, so they brought them into the hospital. Well, they were treating them basically with Western medicine. And it was interesting that beside each patient's bedside was a container of black liquid. And we said, "What is that?" They said, "Well, these patients are very stiff. And the most limber animal we know is a snake. So we put about 40 snakes in a kettle, we boil them, and we pour off the liquid, which is the black liquid, and we put it by the bedside and have them drink it every day." The rheumatologists kind of looked at each other and that was the end of that story. So after we left the big hospitals and the big professors, we went to they call them the barefoot doctors in China. these are doctors in the rural areas that are taking care of people in the rural areas. And their clinics are kind of shabby. They're just barely adequate to take care of their needs. And they're usually long and narrow buildings, and they're real shabby. You walk in, and inside this long, narrow building, there's a long, narrow table. And sitting on each side of the table are patients, and their arms are inside glass tubes. And inside the glass tubes are bees. And these patients are getting stung by the bees. And they come in 3 or 4 times a week to get this treatment. So we asked the rheumatologist, what are you treating? And they said, these patients have either rheumatoid arthritis or multiple sclerosis. And the bee venom gets them well. Well, again, we looked at each other and kind of winked. And now, if you go to PubMed in the past 4 years, there are many, many articles that appear in peer-reviewed journals, medical journals, indicating that when they put the Borrelia in culture and they add bee venom, it completely eradicates it. So these patients were getting the bee venom to kill the Borrelia that was causing their rheumatoid arthritis and their multiple sclerosis. Of course, now we know it treats other things, but I thought that was so fascinating, and that was an ancient treatment. In fact, I've been told now that some of the small villages in Israel raise bees, and they have beehives, and people come from various communities to these small villages 3 or 4 times a week to get bee sting therapy.
That's amazing. Yeah, that's amazing. I have a patient right now who has been using bee sting therapy for her Lyme disease and Borrelia infection, and it does help. So my question for you regarding this bee therapy is, what's the mechanism? Do we know the mechanism of how it can help with Borrelia?
It eradicates Borrelia.
Wow.
So you're getting rid of the fire. You're putting out the fire. And many of the patients will ask me, will I get completely well? And I tell them, it depends on how much damage has been done.
Mm-hmm.
And the analogy I use is, let's say your house is on fire and the fire department comes to grab the fire. Well, if the fire had just started, the house still looks pretty good when the fire's put out. But if the fire's been a long time going, the house is in need of repair. And putting out the fire is not going to replace the house to its previous condition. You need to bring in lumber and nails, etc. And that reminds me of an interesting case. And this happens to be similar to my wife. And about 3 years ago, let me preface this by saying that the Borrelia can affect, in a human body, there's an autonomic nervous system and then there's a voluntary nervous system. Voluntary is the nervous system that we use to give commands to our body. The autonomic nervous system acts on its own with just reflex. And the autonomic system innervates the muscular layers around arteries in the artery blood vessels. And when muscles are activated, the blood vessel constricts. So about 3 years ago, my wife was walking through a shopping mall and suddenly dropped to the ground. She broke a tooth. She was unconscious. So I immediately thought, oh, wow, this has got to be some kind of a cardiac arrhythmia. Her brain was starved for blood. And I took her to the cardiologist. He monitored her heart for 14 days with a monitor, and the rhythm was perfect. He said, tomorrow morning, we're going to put a monitor under her skin so we can monitor it for a longer period of time. And I thought for a minute, I said, let's put her on a tilt table first. And they put her on a tilt table. For the people that are listening, the table is flat. The patient is strapped to the table, and it slowly goes up. Well, when it was upright, my wife's blood pressure dropped to 70, and she became unconscious. Now, almost simultaneously, my wife developed dementia. And my wife is truly, not because she's my wife, but truly a brilliant woman who's a life master in bridge. She just loves intellectual challenges. And she played bridge several times a week. She had complete dementia. So after doing all my research, I knew that dementia and orthostatic hypotension are both caused by Borrelia, can be caused by Borrelia. So I tested her for Borrelia. She was positive. I started her on antibiotics, and after about 3 or 4 months of treatment, I put her back on the tilt table, and when it was upright, normal. But the dementia persisted. So she needed to repair the damaged neurons in her brain. And the only way I knew to do that was with stem cells. Now, in the fatty tissue in the abdomen, on the wall of the abdomen, are mesenchymal stem cells. So I had a physician harvest mesenchymal stem cells. It's sort of like doing a liposuction. And then I sent these to a lab that cultures them. And when she had 300 million mesenchymal stem cells, they sent them back to the physician who did the harvesting, and he administered them to my wife by inhalation, intranasal mesenchymal stem cell. And after about 2 months, they had another 300 million, and the same thing was repeated. And about 2 months later, my wife received a phone call from one of her old bridge partners, and the lady said, I would like you to be my bridge partner. There's a citywide duplicate bridge tournament. It's a big, big tournament. And I want you to be my partner because you're the best in town. My wife said, look, I've had dementia. I don't want to change your luck and have you lose because of my dementia. And the lady said, look, I trust you. So my wife said, okay. So she came back. She went to the bridge tournament, lasted all day. And that night, I met her at the front door as she entered. I said, how'd you do? First place.
Wow.
So mesenchymal stem cells is one way to replace, and I didn't want to administer them to her intravenously because they get caught in the lungs. They get trapped in the lungs, and then they don't get to the inside the brain. But I read some articles where they put labeled cells in rats. They gave the rats nasal inhalation, nasal administration, and then they sacrificed the animal, and they found the tag cells inside the brain. So I knew it worked. So that's how we administer.
Wow. That's amazing. Because usually with Lyme disease, you don't think about dementia. And in your case, you found it, but it sounds like the neurons got damaged. So we needed an extra
Well, I'll
therapy.
tell you, and this is written up in the literature, and it's written by Dr. Alan McDonald. And I encourage all of your listeners to review the things that he's written. He is a certified pathologist. He also spent some time at the Mayo Clinic, and he wanted to learn more about Borrelia. And he'd been hearing so many things about it. And he said, Borrelia is a spirochete. He said, the only other illness that I know is syphilis. It's a spirochete. He said, I'm going to study some syphilis, see if I can learn about the Borrelia. So he started looking up the syphilis. And of course, when I was in medical school, syphilis was known as the great imitator. And every single patient that walked into the medical school got a VDRL. And the CBC said, read your analysis VDRL. Every patient got a VDRL. Why? Because of syphilis. Syphilis was a great imitator. When I got to the Mayo Clinic, every patient at the Mayo Clinic, every patient in my practice, we did a VDRL to make sure they didn't have a great imitator. But they don't do that for Borrelia. But anyway, he started looking at the syphilis illnesses, and he noted that the dementia of syphilis and the dementia of Alzheimer's were indistinguishable. So he said, syphilis is a spirochete. I wonder if other spirochetes could cause dementia. So he went to the Harvard Brain Bank at Mass General Hospital, and this is a video that he made. You can pull it up on the internet. And he picked up 10 autopsy specimens of Alzheimer's brains, and he studied them under the microscope. He found the Borrelia spirochete in 7 of the 10. He said, yeah, he almost fell off his chair. He couldn't believe it. But when I heard that, every case of dementia needs to be tested for Borrelia.
Wow. That's something that I have not heard of. And I truly believe it because there's a lot of Lyme and that is a great imitator out there. And Lyme can do so many things to the body and affects almost every organ. So one thing that we haven't touched upon is what are the symptoms of Borrelia? Uh, because there's a lot of symptoms that can come out from Borrelia infection that we haven't mentioned.
I'm glad you asked because the Borrelia can infect every organ in the body. And the impact on the patient depends upon where the greatest concentration is of the Borrelia. If it's in the brain, of course, you have the neurodegenerative diseases. If it's in the joints, you have the so-called rheumatological illnesses. So it just depends. And every joint in your body, every joint, the little tiny joints up and down the spine, the big joints in the hips and shoulders and elbow and knees is lined with synovial membrane. Borrelia have an affinity for synovial tissue. So the Borrelia gets into the joint, destroys the joint, and you develop the arthritic symptoms, the rheumatological symptoms. And when you eradicate the infection, those symptoms disappear. Now, I might also tell you this, and this is a very important concept. Let me just say there's three ways an individual can become infected with Borrelia. One way is from the mother to the fetus, to the placenta. And by the way, when those children are born with the Borrelia, when they get to be about 2 or 3 years old, they develop autism. Autism is caused by Borrelia. Treated with eradicate the infection, autism goes away. So the one way is from the mother to the infant through the placenta. The second way is from a tick bite, and that's very common. And the third way that most people are not aware and should be aware, sexual. This is a sparky, exactly like syphilis. And I tell my patients in advance, I'll tell all the patients that I'm involved with, your treatment is going to fail, 100% fail, unless your sexual partner is being simultaneously treated. Because these patients, you treat the Borrelia, if you eradicate it, they get reinfected. And even at the big major institutions, they have now a new diagnosis called post-treatment Lyme disease syndrome, especially Dr. Alcott at Johns Hopkins. He's publishing all about post-treatment Lyme disease syndrome. None of these patients, he treats them for 3 months, they get well. 3 months later, they come in ill, back with their Lyme disease. He says, you can't get rid of it. But he never tells them to have their sexual partner simultaneously treated. It's just like ping pong, It goes back and forth, back and forth. If the sexual partner has it, I guarantee you, if the patient has it, the sexual partner has it. And by the way, because my wife had it, I tested myself. And I was positive. And I had so-called old age osteoarthritis, had big swollen joints. You could tap one side of the fluid on one side of the knee and you could see a fluid wave go to the other. I had synovial tissue in my fingers that was thickened. I could no longer wear a wedding band because of the thickening and swollen joints. This is so-called old age arthritis. And by the way, some of these people also become hard of hearing. And it's all attributed to being old age. Well, when I got the diagnosis of Borrelia, I started treating myself. And lo and behold, all of my joints that have been infected got well, completely well. And my wife also had some some decreased hearing. That hasn't changed because the Borrelia affects the auditory nerve. But fortunately, didn't have that. But so-called arthritis, wear and tear, osteoarthritis, it's Borrelia.
And how did you treat yourself? Did you give yourself doxycycline and Flagyl?
Yes, I did. I went on the pulse method, and I had very, very good success.
How long did you treat yourself for?
Several months.
Several months.
Yeah. And by the way, as far as treatment goes, there's three. You can use the antibiotics, and some people, I had a tremendous resistance some people were very resistant, didn't want to take antibiotics. But when I came up with, there's some ancient herbs that have been used, and there's some medicines that contain several of these, and they've been proving to be also very successful. And more recently, there are some repurposed medications that are proving to be very successful in eradicating the Borrelia. For instance, disulfiram, also known as antabuse. Patients who have alcoholism, they put them on antabuse, so they don't touch liquor, because the antabuse, if they have antabuse and they touch liquor, they're going to get very ill. So it gets them off the liquor. Well, the disulfiram has been shown with a culture of Borrelia to eradicate the Borrelia. So treatment with disulfiram is also proving to be very, very successful.
And would you treat disulfiram, use it by itself, or do you use it in conjunction with the antibiotic?
Well, it's proving to be active by itself.
Wow.
Very, very powerful. Now, it has many side effects. You have to be very careful. And the dosage has to be increased by very tiny increments, very tiny increments, because the side effects are very, very tolerant.
And how about, there's some research recently on dapsone as well being helpful for Borrelia. Have you come across that?
Yes, I have come across that. I haven't used it, but some of the my fellow physicians are finding it very good. And by the way, as rheumatologists, you and I, there's so many illnesses that that you treat and that I was treating. You mentioned rheumatoid arthritis. I'm convinced every rheumatoid arthritis patient that's been tested, 100% are positive. Lupus, 100% are positive when properly tested for Borrelia. One of my fellow physicians said a nurse came into his office. She had been to many, many, many doctors, and she had terrible illness. He diagnosed her with Borrelia infection. He started on treatment, and she began having severe pain up and down her spine. And by the way, when I first start the patients on treatment, I tell them about their sexual partner. I also tell them about the Herxheimer reaction, because if you don't tell them in advance, when the medications that you use, whether it's herbal or antibiotics or disulfiram, if it kills the spirochete, the spirochete breaks open, and the inner toxins flood the patient's bloodstream, and they feel terrible. If you don't alert them in advance, they'll contact the doctor who's prescribing this. I can't take that medicine. I'm allergic to it. Makes me feel terrible. And the doctor tells them, good. That means it's killing the spirochete. So it's very, very, very important.
And with the Herx reactions, what do you give for your patients to prevent them or minimize the Herx reaction?
Well, I'm glad you said that, because the main thing is that the Herxheimer, the toxic substances are in the patient's blood. So I encourage them to become very, very hydrated, to try to wash this out through their kidneys. And that's very effective. Also, aspirin helps decrease some of this. And there is another drug that I found successful. And again, I have no connection with this company, but it's called Researched Nutritionals. They have supplements. And there's one supplement that they make called cytoquil. And it's supposed to quell the cytokine storm that occurs with the Herxheimer reaction. And I tell the patients who are taking these medications, purchase that supplement, use it when you're having your Herxheimer, or in some cases, when they take the medication to kill the Borrelia, simultaneously take it to minimize the spread of Herxheimer. But you don't want to do away with, you don't want to prevent the Herxheimer, because that's a good sign.
Yeah, the Herx is a natural reaction because you're killing off, you're releasing all the toxins. It's a natural immune response. So,
by the way, let me also mention there's some other specialties that completely ignore the evidence. Cardiology. One of the most common cardiac arrhythmias is atrial fibrillation. If cardiologists do not have a Borrelia infection in their differential diagnosis, but is one of the most common causes of atrial fibrillation. And the Borrelia invades the heart, causes the myositis, cardiac myositis, and it works its way up, and it interferes with the electrical circulatory system, and the patients develop an arrhythmia, and it can keep working its way up the heart and can cause aortic stenosis. But the cardiologists don't even have this on their radar. It should be on every patient. And currently, and by the way, there's a YouTube made by Dr. Neil Spector. Dr. Neil Spector, very informative YouTube. I encourage everyone to look at it. Dr. Neil Spector was a brilliant young oncologist on the staff at Duke University. He was doing tremendous research, and he developed some cardiac problems. He presented himself to his fellow physicians on the staff, on his academic staff at Duke. And the first thing they ended up doing was giving him a pacemaker. And then later his condition worsened, and they put in a defibrillator. And the muscles of his heart began to deteriorate, and they finally did a total heart transplant. And he said when they took his old heart out, it was covered with Borrelia.
Wow.
They gave him a new heart, and that was very successful. And he discusses this in his YouTube. More recently, he passed away, finally. But it's such an interesting pathway and the patients in gastroenterology, patients with Crohn's disease. There have been patients with Crohn's disease, and they're positive for Borrelia. They treat him, he goes away. It's scary. I mean, there are other inflammatory bowel diseases. And by the way, as a physician, you and I encountered numerous cases of irritable bowel syndrome. These patients, usually you want to send them to the psychiatrist. But many of the patients who have the irritable bowel syndrome also have fibromyalgia. And those two things often go together. And the medical community thinks, well, fibromyalgia and irritable bowel syndrome are both psychiatric problems. They are both caused by Borrelia. And if you eradicate the Borrelia, they go away. I've even gone to my old charts, and some of the patients that I diagnosed with fibromyalgia, and by the way, they were so grateful. They said, finally, a doctor can put a label on my symptoms to tell me what I have. So I've gone back to them. I said, please go get tested for Borrelia. They're positive. They get treated. Fibromyalgia goes away.
Right. I've seen that as well. And you mentioned post-treatment Lyme disease syndrome earlier. That's what the IDSA uses, and rheumatologists, we use that term as well. But there's also another term with chronic Lyme. What's the difference between the two? Because traditional medicine doesn't believe in chronic Lyme.
There's no difference if the patient is getting reinfected either from the environment or from their sexual partner. There's no difference. Or they weren't treated properly. They didn't open up the cyst, or they were treated and not followed properly to see if they were just killing the vulnerable spirochetes, and those that were buried deep, let's say in an Achilles tendon, they come out later. It's a big problem.
Yeah, because from how I've learned it is that post-treatment Lyme disease syndrome means that the bacteria's been killed off, but then you can manifest with other symptoms afterwards, like psoriatic arthritis or rheumatoid arthritis. But with chronic Lyme, the bacteria is still present in the body, and it's causing active symptoms. That's the way I've learned. I don't know if that's correct, or would you call it any differently, describe it any differently?
No, it's their original treatment was not adequate. And this reminds me of a very interesting story. I always went to medical grand rounds at the medical school. And a couple of years ago, I was sitting next to another rheumatologist who was also retired. I hadn't seen him in a while. So we visited, and after grand rounds, we were walking to the parking lot. And I asked him what he was doing in his free time, and he told me. He asked me what I was doing, and I told him about the Borrelia. And he said, well, in 1980, he said, I diagnosed my wife with psoriasis and psoriatic arthritis. And I started her on treatment. He said, if we went walking, she could barely keep up with me. Her psoriatic arthritis was so bad. He said, but more recently, she's developed dementia. And she was very smart. He says, I'm just so distressed. I said, well, if she's got dementia, let's test. We tested her properly. She was positive, started her on treatment. And a few months later, he contacted me. He said, the dementia is better, but not cured. He said, but you won't believe this. He says, her psoriasis is just in remission, and her psoriatic arthritis, said her joints are so much better, I can hardly keep up with her when we go walking.
Wow. That's amazing. These are stories that you don't typically hear from your typical rheumatologist about psoriatic arthritis. And sounds like there's so many ways of treating this. And are you worried about the gut microbiome at all when you cycle the antibiotics? And how do you help the gut microbiome? Do you just give probiotics?
Yes, I insist. And the fact that the patients are taking them 3 days a week, 3 days on, 4 days off, gives the microbiome an opportunity to heal and to regenerate. But it's very, very important. I tell them, take a probiotic every day. And I also give them to make sure that there was no yeast overgrowth from the antibiotics. But I try to always limit the antibiotics to 3 days on, 4 days off to give the microbiome an opportunity to replenish. And there are certain, there's some doctors that use, there was an article that's stevia, the artificial sweetener stevia. So they had to give it to their patients. And there's some articles that say in culture, the stevia, if you put Borrelia in culture and you add stevia, it will eradicate the Borrelia. So they said, let's treat the patients with stevia to get rid of the Borrelia. The thing is, the Borrelia goes in your mouth and out your rectum and doesn't get into your systemic circulation. And that's why it has no calories. Stevia has no calories because it's not absorbed. And it's not going to kill any Borrelia because it's not absorbed. It goes in your mouth and out your rectum. But it does kill any bacteria that it comes in touch with. So I tell the patients, do not take stevia because your microbiome will be eradicated by the stevia.
So when we take antibiotics, we want to avoid stevia, it sounds like, because we want to
avoid it completely, even without the antibiotics, because you don't want to disturb the microbiome.
Right. I see that with other on studies on other artificial sweeteners such as aspartame as well. It can
Well, let me just say about aspartame. When aspartame first came out, I ended up going to Washington and testifying in front of a Senate committee. And Senator Metzenbaum invited me because when aspartame first came out, I had several patients who had terrible, terrible side effects. I had one patient, her husband had diabetes. So they took all the sugar out of the house and they replaced it with aspartame. And she was consuming the aspartame. And she had horrible migraines and she could hardly function. And got her off the aspartame, all the headaches disappeared. I testified in front of Congress and aspartame, there was a psychiatrist there, a physician there from Harvard who was testing, he gave rats aspartame and they had brain tumors from the aspartame.
Wow.
By the way, talking about brain tumors, the same Dr. Alan McDonald that I mentioned earlier, he noted an increased number of patients who have Borrelia infections also had glioblastomas. That's a horrible brain tumor. And so he decided to look at the glioblastoma. And so he collected glioblastoma specimens that were removed in surgery. And he found that they were filled with Borrelia.
Wow.
And that reminds me also, the brains of patients who have mental illnesses, a variety of mental illnesses, their brains have a high concentration IL-6. IL-6 is produced by cells that prevent the infection from spreading. Those cells produce IL-6 to confine the infection. Glia cells are not anti-infection cells. They're brain cells. They don't produce IL-6 unless they put glia cells in culture and they added Borrelia. They produced IL-6.
Wow, that's amazing. I've never heard of that. That's very
You can see it on the web. Go to the website, PubMed, you'll find it.
wow. Yeah, I'll have to look it up after this talk. And you know what's interesting is that you and I are both rheumatologists, and this conversation rarely comes up between two rheumatologists. So I want to know, based on your experience, would you say that all rheumatologic diagnoses pretty much has a possibility of having Borrelia as an infection, including vasculitis, scleroderma, all these really complicated autoimmune illnesses?
100%. 100%. And again, I think the concept of autoimmune, it's erroneous. It doesn't exist. And all of these illnesses that you just mentioned, if you test the patient properly, they're positive for Borrelia.
Yeah, I hope there's rheumatologists listening to this talk at some point, because this will give them a lot of education on Borrelia and co-infections as well. Because we don't learn this, even today, we don't learn this in fellowship, not the way we're talking about it today. And did you use we talk a lot about antibiotics, and you briefly mentioned about herbs. Did you use herbs in your practice as a rheumatologist back in the day?
Well, I was not focused on this illness when I was practicing. It wasn't until after I retired. So therefore, and as a retired physician, I don't prescribe any medication. However, when I encounter patients who are resistant, or their physicians are resistant to treat them with antibiotics, and they only want to take herbs. And again, I'm not associated with this company in any way, but Amazon has a product called Tick Immune, Tickimune, Tick Immune. Tick Immune is made up of many herbs that for centuries have been used by various cultures to treat infections. Tick Immune, Cryptolepidus obligata, that if you put that on a culture of Borrelia, it wipes it out. So Tick Immune is proving to be also very effective. Many were reluctant to take antibiotics.
Right. In the literature, there are reports and studies show that these different herbs are and can be effective against Borrelia and the co-infections. I want to briefly talk about Bartonella real quick, because we talk about Borrelia a lot. With Bartonella, did your treatment plan change when you found the patient with Bartonella as well?
I tried to eradicate the Bartonella, and you can eradicate the Bartonella with antibiotics, specific antibiotics, and you can treat them for 60 days every day, and it's gone. And I encourage the patients to let's address your Bartonella and get rid of it so that we can focus on the Borrelia, because you can't do both at the same time.
And which antibiotics did you give for Bartonella? Did the antibiotic regimen change?
Yes, rifampin and erythromycin.
Erythromycin. Did you ever use rifampicin, or was it mainly rifampin?
Rifampin.
Rifampin. And did you see a lot of babesia during your practice as well?
During my practice, I didn't look at this. This was not on my radar.
Oh, got it. Okay. I've seen some patients in my practice so far with not only Borrelia, but Bartonella and babesia together
Yeah.
with their rheumatic disease, which can be quite challenging sometimes. And with these,
Those, you can't ignore those co-infections. They are significant and they should be addressed. And there are many treatment protocols that are very effective in the literature. I tell the doctor, go to one of those and try it.
yeah. And so in the past couple of years, since you do so much research on this topic, has your view changed at all? Has the treatment changed at all in the past couple of years since you've done this research at all? Any new things on the horizon regarding the treatment of Borrelia? and the co-infections?
Well, these repurposed drugs like disulfiram, that's something new. And let me just say, excuse me, recently the military have patients who have PTSD, post-traumatic stress disorder. And they also have many neurodegenerative diseases, and they blame that on TBI, traumatic brain injury. And I looked into those, and in this country, they blame it on patients who, in this country, it's because of the trauma. When I went to the literature, and in Europe, especially in Italy, the Italian soccer players have a high incidence of neurodegenerative diseases. And they blame it on hitting the ball with their head, again, getting traumatic brain injury. And I kept looking it up, and Italian agricultural workers have a high incidence of neurodegenerative diseases. In this country, golfers, people who golf a lot, the U.S. military, these people have a high incidence of neurodegenerative diseases, and because they're all exposed to the environment. And in the military, this post-traumatic stress disorder and TBI, traumatic brain, they blame it on the stress that the individual has been on. But when you do the proper testing, they're all positive for Borrelia. In fact, last night on TV, I don't know if you were watching, but there was a shooting incident in New York City that occupied every channel on the TV. It's very interesting. I have found, well, there's one condition that's known as Lyme disease rage, R-A-G-E, rage. And these patients who are infected with Borrelia, they can be Boy Scouts. I mean, they're just, wonderful citizens. And all of a sudden they go into a rage. And many of these murders, they're massive murders, are due to Lyme disease rage. For instance, in Newtown, Connecticut, there was an Adam Lanza. He was born to a mother who had multiple sclerosis, and he was very slow to develop. She transmitted her Borrelia to Adam Lanza, her son. And when he became about 20 or 21, and she did homeschooling because he was so fragile, they didn't want to send him to school. She did homeschooling, and she was very dedicated to him. And when he turned 21, he woke up in the morning, he killed his mother, he went to the Newtown Elementary School, he shot 22 students. He didn't shoot them once, he shot each of them multiple times. He was in a rage, Lyme disease rage. And right around that same time, there was an article about a chimpanzee living in Connecticut. His name was Travis. And he was a friend, he was a member of the family, this chimpanzee. He had a seat at the breakfast table. He ate with the family. All of the family's friends that came in, he befriended them. They just loved Travis. And one day, one of the family friends walked in, a female, and he tore off her face. I don't know if you remember hearing about this. Chimpanzee off a woman's face. So I looked into the literature. Travis had been treated for Borrelia infection, for Lyme disease. And he went into a rage and tore off this woman's face. Well, and this fellow last night who killed all these people, his medical history shows that he was a football player. And when he retired from being a football player, they said that he had CTE, concussion, traumatic concussion from football.
Mm-hmm.
He went into a rage last night. And there was a recent illness, another severe killing. A healthcare professional was killed by a fellow named Mangione. I don't know if you recall seeing that on TV. This healthcare person was walking down the pathway. Mangione that picked up a rifle and killed him. And if you look at Mangione's history, he came from a very wealthy family. He went to the finest schools. He was an outstanding student. And in his college career, he developed Lyme disease.
Wow. Yeah, you're talking about the incident with United Healthcare.
Yes.
The CEO was murdered.
Killed. Yeah, that's what I'm talking about. He was killed by Mangione. If you look at Mangione's history, Mangione in college was bitten by a tick and developed Lyme disease. And he went into a rage and shot this individual.
Wow.
So Lyme disease raised, I mean, and here in Texas, not too long ago in Uvalde, Texas, a shooter went to the elementary school. He killed so many of these children. And, you know, people don't realize this, but what is the cause of Bell's palsy? When I was in medical school, when I was in practice, the cause of Bell's palsy was a virus. But now we know that Borrelia causes Bell's palsy, and it infects the nerves in the face. And so many, I've looked at the perpetrators of these mass murders, like the one that killed the children in Uvalde, and many of them, not all of them, but many of them show evidence of previous Bell's palsy. So the organism is in the patient. They still have the Borrelia. They went into a rage, and that's what it causes this horrible murders. And, you know, on the TV, they say, well, what could be so evil in someone to do something so horrible? And Dr. Alan McDonald says, if the Borrelia gets into a certain part of the brain, it triggers the rage. Dr. Alan McDonald also found that in other forms of dementia, with bodies, Lewy body dementia, he looked at the Lewy bodies. Right in the center of the Lewy body is Borrelia.
Wow. So Borrelia really affects from brain to toe, really everything.
Everything. There isn't anything in spirit.
Wow. And you know, there are people that still claim that there is no Lyme or Borrelia in certain parts of the world. Is it worldwide pretty much? Is it in every state in the US now?
It is in not only every state, but every country in the world. In Europe, they have a different Borrelia. In China, I mentioned a lady who was diagnosed with the Borrelia in New England with the dementia, and she had Borrelia miyamotoi.
Mm-hmm.
And that's a Japanese specimen of Borrelia. There isn't a single country in the world that's spared. Every country has Borrelia. And we need to consider it just like we consider syphilis, and every patient should be screened for Borrelia.
Right, exactly. It affects everything, and unfortunately, it's under tested. And when it is tested, it's tested with the wrong labs that are not sensitive enough and specific enough. So, I really appreciate you coming on and giving us all this education on Borrelia and the co-infections, because it really affects all of us.
Yes, even podiatry. Who would think that podiatry would be involved with Borrelia? Well, what causes plantar fasciitis? They go to the podiatrist. He gives them a big cushion, gives them some steroids. But if you go to Club Med, you'll find that plantar fasciitis is caused by Borrelia. It also involves the Borrelia gets into the synovial tissue of the toes, and they develop hammer toes, you know, one toe overlapping the other. Who would think that that's related to Borrelia? Did I mention osteoporosis?
We didn't talk about osteoporosis yet.
Okay, so my youngest daughter living in Boston developed an upper respiratory infection and began coughing. And she coughed and broke a rib. And she called me and said, Dan, I broke a rib. What do you think? I said, go get a bone density test. And she called me back and she said, the bone density test showed that I had osteopenia. I said, well, go to your doctor and tell them to put you on something to strengthen your bones. And after about 3 months of taking the medicine, she went back and had a repeat bone density. And this time she said it showed osteoporosis in spite of the treatment. So I went to the medical literature, and every bone has two cells, osteoblast and osteoclast.
Mhm.
And the clasts break down the bone, and the osteoblasts build it back up again. So over the years, our skeleton has been constantly remodeled by these two cells. But when they put the osteoblast in culture and they added Borrelia, it wiped it out.
Wow.
When they put the osteoclast in culture and they added Borrelia, had no effect. So the osteoclasts are breaking down the bones, but they're not being rebuilt. They developed osteoporosis.
Wow. That's amazing. That's never talked about in
That's right.
rheumatology.
So, and I had my daughter tested for Borrelia positive. Treated her with anti-Borrelia medication, and she's fine. But and if you contact the osteoporosis centers around the world, ask them, are they testing their patients for Borrelia? No, never heard of it. Just like with orthostatic hypotension, you ask the patients, the medical centers, patients come there from all over the world, are you testing for Borrelia? No, never heard of it.
And with your daughter, did her T-score DEXA scan for the osteoporosis, did it get better after the Borrelia treatment?
Yes.
Oh, wow. Wow. And did she take the osteoporosis medications at the same time she took the Borrelia medications, or was this the Borrelia?
Both.
Okay, both. Excellent. Wow. This is I'm so grateful.
But when she didn't treat the Borrelia, she just took the osteoporosis medicine, it didn't help.
It didn't help. Exactly. Yeah. Well, I'm very grateful that we're having this conversation because it's going to help so many people and get a lot of people educated on this topic, not only patients, but doctors as well, because I'm sure some doctors are listening to this and it's going to revolutionize the way they hopefully the way they practice. So, I'm very thankful for you to take your time today, to speak with me. How can people, yeah.
People ask me, how come other doctors aren't doing this? And I always tell them it's difficult to get someone to understand something when their livelihood depends on their not understanding it. And I've contacted so many neurologists. There's one neurologist here in San Antonio. She's the head of the neurology department now. She's the local expert on ALS. And patients that are referred to her, the primary care physicians refer every ALS patient to her. And some of the primary care physicians remember me from where I was in practice, and they've contacted me because they've heard about some of the things I'm doing now. I tell them how to test their patient for Borrelia, and they are positive. And they take the paper that shows the positive Borrelia infection to the neurologist, and the neurologist says, forget about it. Doesn't mean anything. And these patients are now 6 feet under the ground.
Yeah. Yeah, I've heard that. I've seen that in my own experience as well, which is really unfortunate. So hopefully more awareness spreads about this information. And how can people find you? How can they reach out to you?
Okay, well, first of all, the best way is through an email. I'm going to give you my email address, and don't hesitate. They should not hesitate to contact me because I'm available 24/7. I'm passionate about this subject, as you can tell. My email address is very simple, all lowercase letters, no punctuation marks, Dr. Al Miller at gmail.com. So it's DRALMILLER at gmail.com. They can send the contact information to me there. And also have them keep in mind that I don't treat. So if they are going to contact me and want how to get properly tested, how to get properly treated, they have to have a cooperative primary care physician who will cooperate with me. Otherwise, we're just wasting our time.
Yeah, you're essentially a guide and a resource in this. You're not their doctor.
Exactly.
Excellent. We'll have that email in the show notes. I think you're very generous for getting your email out, and hopefully patients do get helped and they get fixed and hopefully cured with their medical condition. So thank you so much. I'm so happy to talk to you today, and thank you so much for finding me. Just to let everyone know, Dr. Miller found me through YouTube. His son found me on YouTube, and then that's how we got connected. We talked on the phone, and then we decided to do a podcast together to educate you all. So thank you so much for sharing all your knowledge and wisdom with us today.
Thank you for allowing me to make this presentation. You and I have got to spread the word and educate people and their physicians.
Excellent. Thank you so much for listening, everyone. Thank you, Dr. Miller.
Okay, thank you.